Dr. Ravi Patel with the Comprehensive Blood and Cancer Center is here to talk about recent advancements in cancer research. All right, Ravi, thank you so much for joining us.
Yeah, pleasure.
It's so nice to meet you and finally be able to talk to you about this stuff. Okay, so I kind of wanted to talk about what is molecular profiling of cancer and how is it helping out cancer patients?
You know, it's an important thing. Cancer has a complex amount of genes. And, you know, in the past, what you hoped was you throw a bomb and hope the bad guys would die. But now you can just go after the bad guys.
Oh, awesome.
By understanding the genetic makeup of the cancer, you can identify certain drugs which target certain genes. And as you identify those medications, the side effects become a lot less because you're going right after the cancer. There's also new antibodies being developed against certain cancers, for example, lung cancer, pancreatic cancer. So a variety of ways you can attack the cancer cells and spare the side effects of a lot of the devastating chemotherapy.
And cancer research is a very evergreen topic at this point. I mean, we're learning something new every day. Can you tell me kind of what are some of the clinical trials at CBCC is doing with UCLA?
So we're involved with UCLA in all four major cancers. Four major cancers are breast, lung, colon, and pancreatic cancers. And we have trials which are for a very aggressive kind of breast cancer called triple negative breast cancer. Happens to be the most aggressive breast cancer. We also have a trial targeting a deletion which happens in the lung cancer, and then another deletion which is a genetic deletion called MTAP mutation in pancreatic cancer. So we have trials covering all of those.
Yeah, and what options are available for patients with lung cancer that has spread to other parts of the body? I mean, you were saying lung cancer is one of those big four. So what are we looking at here?
So, you know, there's different things which you can do for lung cancer. Fortunately, lung cancer also has a lot of genetic mutations, and you can identify the mutations in lung cancer. Particularly in what is called non-small cell lung cancer, there's a tremendous amount of genetic mutations. You can identify those, target the cancer based on that. In older people, for example, if they cannot undergo surgery and they have a mass in the lung, we can use a gadget which is called a cyberknife, which is absolutely precise, attacks the cancer, and you can give them radiation to that area. Also, there is now robotic ways of doing surgery on the lung so that the damage to the body is a lot less, recovery time is a lot more easier.
Yeah, and I mean, that's such an important topic to talk about. I mean, I think it's important to look at the advancements made are here to benefit these patients because going through cancer, going through diseases like this, it's not easy. So what are the benefits here of these developments that you're talking about? What are the benefits for the patients?
So tremendous because the recovery time is very swift. And that was an excellent question. Since the recovery time is easier, the side effects of the chemotherapy or the drugs are much less than the past. You can prolong their lives. And even if you have stage 4 cancer, you can have a quality life for a period of time and a meaningful life.
And that's something that we haven't seen in a long time.
No, it's definitely happening.
Yeah, going off of that, can you kind of explain the difference between hospice care and palliative care?
Yes, very important. You know, the reason is that's an important one you're bringing up. So, you know, hospice care is when the person decides, look, I've gone through this journey of cancer, my options have been exhausted, and I just want to be comfortable and surrender to God, or do what I want to do comfortably. And that's hospice care. Palliative care is where you have the cancer and you want to continue to do everything to keep yourself comfortable and take treatment.
Gotcha. So what we were kind of talking about with how these new treatments are less harmful for the patient involved. It has a much swifter recovery time. So does that kind of tie in with?
Very much.
Okay, very much that ties in with that palliative care.
Palliative care, very much.
Okay, awesome. Well, thank you so much for coming in today, Dr. Patel.
Thank you.
We'll be right back coming up after the break.